Q&A tab, and that way it comes straight through as a question. I also want to bring to your attention that we have an animator. Her name is Ren. She's working in the back end, and she's capturing this conversation through animation. So at the end of our time together, we're going to project that final product and hopefully be able to say, this is what a creative capturing of the conversation has looked like. So Ren, thank you so much for the work that you're doing in the back end as we now get ready for our very first panel. Now, remember that I said this panel is an opportunity for us to really reflect back on the challenges as well as the lessons learned from public health-orientated partnerships on the continent. And leading this conversation is my brother, Alan Kasuja. Let's give him a big round of applause as he comes up, please.
First of all, let's give you a round of applause for work that's brilliantly done. You're looking amazing. Thank you very much. And Larry and Dr. Guel, what a profound conversation that was. Thank you very much. A lot of things to take away from it. My name is Alan Kasuja. I am a lead presenter on the BBC World Service. I present a program called Newsday, and I also present the biggest, most important podcast that everybody should subscribe to. It's called Africa Daily. We have, we have about 400 episodes on there that will cover everything and everything on the continent. We make sure that we give it context and we try to explain it as much as we can. It's a real honor to be here to have this very important conversation. And I'd like to introduce you to my panel. I'm a bit intimidated by how well Larry's panel went. So a conversation went, but it was a great way to set this conversation up as well. First of all, I'd like to invite over Dr. Wafa El Sadar. She's a director of ICAP at Columbia University. Let's give her a round of applause. I'd also like to invite Dr. Anne Githoko Shongwe. She's from UNAIDS, and she's the director for the Eastern and Southern region. Dr. Abubakar Campos, he is the global director of health at UNICEF. Very, very important work. And Dr. Amadou Alpha Sal, he leads the Pasteur Institute in Dakar, Senegal. He's joining us virtually, and it's really good to have this panel with us. Let's give them all a round of applause. We are going to have a frank conversation. There is need for candor, and I encourage you to be as candid as you can, and I'm sure you will be. And I'm going to start off by asking you to mull over where we are at the moment and try to understand what sort of partnerships we have on the continent at the moment and what is working and what is not. If I may start with you, Alpha, first of all, give us a sense of the backstory. What partnerships do we have in place, have we had in place over the last so many moments? What are the pivotal moments in those partnerships? What has worked, what has not? Set the agenda for this conversation for us. Okay, we have more microphones than we thought we did. Yeah, sure.
Thank you very much. It's a pleasure to be here. Really, I'm honored to be here and to have the opportunity to join this amazing conversation, very important conversation and very timely conversation. And I have to say, sitting there, listening to the amazing speakers ahead of us, it really brought back a lot of reflections and memories. And I'm thinking back like 20 years ago when we established ICAP at Columbia University. We had, myself and my colleagues, and both here as well as on the continent, on the African continent, we had a deep conversation about what would be our ethos. What are the principles that would drive our work? And I think one of the principles was clearly the importance, I always say that big problems or big challenges need a lot of different disciplines. So interdisciplinarity was a very important principle that we adopted. I think a second one is a focus on health system strengthening, and that came across very loud and clear today. in terms of the need to enhance institutions, the strength of institutions, enhance the workforce, the capacity of the workforce.
What did that look like 20 years ago? The workforce, the institutions, what did those look like?
Yeah, I'm getting there. Okay. The workforce, as well as the laboratory system, surveillance system, data systems. And I think another principle that we thought about is partnerships, and that the importance of working with local leadership and building partnerships at all levels, at national, subnational level, health facility level, and so on. And lastly, I think very importantly, is a focus on the recipients of the services. I think I've learned that clearly from the HIV response is everything we do has to take into account the recipients of the services. We have to prioritize the work for them. And as we said before, if we don't, we're not going to be able to deliver vaccines, we're not going to be able to deliver services if we don't bring them to the table and listen to them and listen to their preferences and their priorities. So since then, 20 years ago, I would say we've come a long way. And I think it's a credit to Africa